So a lot to go over today. The changes that are happening in 2021 are mostly in the medical. There's some changes to the life insurance and disability products, um, but mostly just in carrier. The pricing stayed the same. So we'll go through that information here. Agenda of the things that we're going to cover today. The medical, as I stated earlier, is changing from Aetna to Blue Cross Blue Shield. The dental and vision are going to stay the same. Some changes to the voluntary products moving over to MetLife. Open enrollment period starts today and will end on November 2nd, which means we'd like everybody to get their information back to us as soon as possible before the deadline. We do have to have everything submitted to Blue Cross Blue Shield by December 3rd in order for everybody to have ID cards by the first of the year. So that's the biggest item there. The dental, the vision, no changes there, so that can kind of roll over, if you will. And then, of course, the benefits are going to be effective January 1st, 2021 until December 31st, 2021. So all employees are eligible for the benefits. Aside from the employees, the legal spouse, domestic partner, and children up to the age of 26. So as I stated earlier, these plans are a full calendar year, January 1 to December 31st. You cannot make changes to any of the plans that are pre-tax deductions, medical, dental, vision, unless you have a qualified event. On the screen, there's some examples: marriage, divorce, birth of a child, change in coverage, things of that nature. If you think you've experienced a qualified event, I would recommend that you reach out to your CBR HR team immediately, so we may give you the forms and go over any changes that can be made. If you do not notify us within 31 days of the date of that event, then you have to wait until the next open enrollment period to make any changes to those plans. All right, we have quite a few medical plans to go over. Any questions before I get started on the medical plans? We'll go ahead and proceed. So we are moving from Aetna over to Blue Cross Blue Shield, and we have quite a few plans to choose from. First plan here is the PPO 2500. So 2500 being the individual deductible, 5000 being the family deductible. In a calendar year, if you should meet that deductible, you're going to go into that cost share or co-insurance with Blue Cross Blue Shield. So it's an 80-20, which means at that point, Blue Cross will pay 80% of all services and you're responsible for 20%. So the deductible on this plan comes into play with major medical services such as inpatient and outpatient surgeries, MRIs and CAT scans, durable medical equipment, things of that nature. That's when you have to worry about your deductible. If you go to the emergency room and you are admitted, you will not pay that copay, but you will start to pay towards your deductible. If you never have any of those major services, you will never have to worry about that deductible. Keep in mind all of your copays. All of your copays go towards meeting that out-of-pocket maximum. So any copay for your pharmacy, for your doctor visits, things of that nature, all of them go towards meeting this $6,350 or $12,700. So if you have a surgery and you pay that $2,500 deductible, that is subtracted from the $6,350. Okay, on this plan and all the plans, your preventative care, which means all the services, your wellness examination for yourself, for spouses, for children, those are all covered at 100% with no out-of-pocket expense. So that's your annual physical. If you need to go to the doctor for a sick visit, whether it's a walk-in clinic, CVS, Minute Clinic, so it's going to be a $35 copay. Specialist is a $60 copay, and you can self-refer to specialists. You do not need your primary care physician to write you a referral. Urgent care is going to be $75, and your emergency room is $250 per visit. Again, if you go to the emergency room and you have to be admitted, that $250 will be waived, but at that point you will start to pay towards your deductible. Any questions so far? I think I went ahead and unmuted everybody. If you have questions, and if you can't ask questions via the telephone line or the headset, please feel free to type them in the chat. Next, we're going to go over the pharmacy. So the pharmacy is covered the same on all the plans with some caveats to the high deductible health plan. So on this plan, your generic drugs, when you go to a pharmacy, sometimes there are $4 generic drugs. The most you will pay for a generic is $10. So you're going to pay the lesser of. So $4 or $10 for those generic type medications. Preferred brand name is going to be $35. Your non-preferred brand name is either going to be $60 or $120. Now, if anybody is taking any specialty type medications, that's your infusion therapy, injectables, that's going to fall under specialty medication. And there's 4 additional tiers there. So the summary benefit of coverage was sent out for each of these plans, and you can review that or contact me if you have questions in regards to where your prescription falls. Any questions on this plan before I move on to the second plan? Okay, the next plan is the PPO 3500 high deductible health plan. This is a HSA qualified plan. What that means is you may open an HSA account and put pre-tax dollars into that account that you may use to pay for medical services on this plan, your dental or your vision for yourself and dependents. So this high deductible health plans mean you, the member, are responsible for the first $3,500 of all services. So if you have to go in for an MRI, a CAT scan, a hospitalization, a baby, you are responsible for the first $3,500 as an individual or $7,000 as a family. If you meet that deductible in the calendar year, that is when Blue Cross Blue Shield will start to pay towards your services. Again, it's an 80-20, which means Blue Cross picks up 80%, you pick up 20 until you meet that maximum out of pocket. So that's your worst case scenario in a calendar year on a high deductible health plan. There are some exceptions to that. So preventative care, preventative medication, and FDA approved contraceptives are all free before deductible. So if you are taking any medication now that you consider preventative and you would like to know where it falls, if it's going to be in that free category, you can email me and I can send you the list or I can research it. The same goes with the FDA approved contraceptives. If you have a question in regards to that, I will be happy to assist. Send me an email or I can research or send you the link to research. So everything is going to be subject to your deductible, your sick visits, your urgent care, your emergency room, and any other pharmacy with the exception of that preventative care medication and FDA approved contraceptives. So everything is going to be member responsibility. But again, you can enroll in the HSA or use your HSA dollars to pay for all of the services. Any questions? All right, we have 2 more plans to cover here. So this is the PPO 1000. This is $1,000 individual deductible, $2,000 family deductible. Again, we're going to run into that co-insurance or cost share. In this case, it's going to be 70% Blue Cross Blue Shield, and you pay 30% to reach that maximum out of pocket of either $4,000 as an individual or $8,000 as a family. Your preventative care is covered at 100% on this plan as well. Your sick visit to your doctors at $25. Again, those are your walk-in clinics, regular doctor visits. Aside from wellness, it's a $25 copay. Specialist, $50 copay. Urgent care, $75 copay. Emergency room is $250 copay. And then your pharmacy is exactly the same as the other plans. So either $4 or $10 for this generics, $35 for the preferred brand name. The non-preferred brand name is either going to be $60 or $120. And then if you have specialty medications that you are taking, I invite you to take a look at that summary benefit of coverage to see where it falls, or you can send me a note and I will be happy to assist. Now the next plan here is a $2,500 deductible plan. and it's a 70/30 after that. So if you happen to meet your deductible, you're going to go into that cost share similar to this plan that we just went over. The out-of-pocket maximum on this plan is $6,350 as an individual, $12,700 as a family. Then you have co-pays for your regular doctor visits at $30 or $60 for your specialist. Your urgent care is $75. Your emergency room is $250, and the pharmacy is exactly the same. Now you have two networks to choose from. So as you see here on the top, it's labeled Alliance, formerly known as Banner. So this is going to include your Banner hospitals, Banner facilities, Banner urgent cares. This is going to be Honor Health, Scottsdale Shea, University Medical Center, and Cardin's Children's Hospital. Those are all in the Alliance network. The other two plans that I went over before the Alliance are in the PPO or National Network. So it'll include all the hospitals I stated before. In addition, it'll include Phoenix Children's Hospital and the Mayo Clinic are included in the other plans that I went over. So there's just a slight difference there in network availability. Also, the Alliance plan, if you have members sitting or living outside of the service area, which is going to be Arizona, probably best to enroll in the other plans. However, if you are within the service area and you have a child or someone living out of state that's a dependent, they will have access to the national network. So they will have availability to regular doctor visits, pharmacy, etc. Any questions on the two networks and the four plans? Okay. One more plan. So this is again an Alliance plan here, and this is a $6,500 deductible. So a little bit higher deductible on this plan. So this would be recommended. It's going to be maybe the lowest price point of your paycheck. $6,500 individual deductible, $13,000 family deductible. If you met that deductible, you've also met the out-of-pocket maximum, and at that point, you are in 100% coverage for all services in network within that calendar year. And that applies to all the plans. Once you meet that out-of-pocket maximum, you're covered at 100%. So you do have your wellness exams here also at no cost. You have co-pays also for your doctor visits, $30 for your regular doctor visit, walk-in clinics, $65 for your specialist. Your urgent care is $75. Your emergency room copay is $250, and the pharmacy again is going to be $3 or $10 for that generic medication. Your brand name medication is $35. And your non-preferred brand name is $60 or $120. And again, if you're taking any type of specialty medication, I invite you to take a look at that summary benefit or coverage to see where it falls. Any questions on the 5 plans that we went over? If you're having trouble unmuting yourself, you can send a quick note in the chat and I will be happy to assist or answer any questions that you may have. Okay, this is some information on the HSA. So the HSA pairs with the high deductible health plan. So again, that's the high deductible health plan where you are responsible for first dollars. So in order to qualify to open an HSA, there are a couple things. Number one, you have to enroll in a high deductible health plan, which you have access to. You cannot be enrolled in any other type of copay plan. So if you are enrolled in a spouse's plan or TRICARE, that disqualifies you from opening an HSA account. If you're enrolled in any part of Medicare, that also disqualifies you from opening an HSA account. And if you are a dependent on somebody else, on somebody's tax returns, or somebody claims you as a dependent on their tax returns or taxes, that also disqualifies you from an HSA. If you enroll in the high deductible health plan and none of these other things apply to you, then you may open your HSA account and put pre-tax dollars into that account. So this is money to use for your medical expenses. This money rolls over. This money is your money. Nobody takes it. If you leave the company, it goes with you. If you open your account with UMB Bank, who is the company that we use and partner with, once you reach $1,000 threshold in that account, you can start to invest those dollars similar to a 401k and money market accounts. And any interest earned in that HSA account is going to be tax-free as well. So some really good opportunities there for investment and savings for your future health needs. The money that's taken out of a check is put into that savings account, and it's available as it's put into that account. So if you do $100 a month, that's how much you're going to have every month to use towards your medical expenses. And again, you can use it for yourself, dependents, medical, dental, vision, pharmacy, and a lot of other qualified durable medical equipment. Every year, the IRS does review the amount of money that you can set aside. So for 2021, they did increase it to $3,600 as an individual. So again, these are pre-tax dollars, $7,200 as a family. And under IRS rules, a family is considered one plus. So one plus a spouse, a child, or an entire family. Also, if you're 55 plus, you can add an additional $1,000 to that. They call it that catch-up provision, which allows you to add that money because once you enroll in Medicare, you are no longer able to put money in the HSA, but then you can start using that money to pay for your Medicare premiums, start withdrawing similar to a 401k, and that's going to be penalty-free as well. Any questions on an HSA? Okay. Next, we're going to go over the flexible spending account. So similar to an HSA, these are pre-tax dollars that go into an account that you can use for yourself or dependents for medical, dental, vision, pharmacy, things of that nature. The biggest difference on the flexible spending account or FSA, the amount that you elect is front-loaded onto this Visa card. So if you elect the full $2,500, you know you're going to be paying for braces for the kids or procedures for yourself or any dependents, you'll have that money to use first of the year. Then it's deducted from your paycheck for the remainder of the calendar year, and again on a pre-tax basis. You can roll over up to $500 per year. If you leave the company, the card and the money stay behind. They do not go with you. That's one of the biggest differences there. Again, maximum that you can elect for the 2021 plan year is $2,500. The maximum rollover is $500. You also have dependent care flexible spending account, pre-tax dollars that you set aside to pay for daycare or elderly care. There are some maximums here to $5,000 or $2,500 if you're married and filing separately. And this money comes out of your check into an account, and you can use those dollars to pay your provider or pay yourself back for those services. Any questions? Okay. Blue Cross Blue Shield has a telemedicine just like all the other carriers. In this case, it's going to be called Blue Care Anywhere. So if you enroll in any of the Blue Cross Blue Shield plans with your dependents, any of the telemedicine visits are going to be at no cost to you. That includes medical diagnostic visits, counseling, and psychiatry. So if you're traveling and the kid gets sick or pink eye or something, upper respiratory, things of that nature that can be treated simply with an antibiotic, you may use your Blue Care Anywhere and have a script written and sent to the nearest pharmacy wherever you are within the United States. So it's a really good service. I do recommend once you get your Blue Cross Blue Shield ID card, go into the bluecareanywhere.com website, enroll, and then download the app to your telephone so it is ready to use when you need it. Next, we're going to go over the dental plan. So no changes to the dental plan. So the same plans you have today are available for the 2021 plan year. So you have the PPO-based plan. So this is a typical dental plan that has an allowance to use towards your services. In this case, it's $1,500 per person enrolled in the dental plan. So if it's you, a spouse, and a couple of children, each of you have that $1,500 to use towards your dental services. And I just had a question pop up here. So sorry about that. The Blue Care Anywhere, which is going to be your telemedicine provider, they are free. There are no copays associated with that at this time. So Blue Cross Blue Shield did that earlier this year, and as far as we know, it's extended into 2021. So no charge for the Blue Care Anywhere telemedicine visits. And yes, it is like Teladoc today that you have with Aetna. It's just named differently by carrier. So it's Blue Care Anywhere using board certified physicians, available 24/7, 365. So going back to the dental, so you have $1,500 to utilize towards your dental services for you and every person enrolled on the plan. So your preventative care, so your cleanings twice a year are covered at 100% with no deductible. Now you may schedule those cleanings anytime during the year. They don't have to be spaced out 6 months, 3 months. None of that applies. Additionally, if you have a medical condition such as coronary heart disease, hypertension, diabetes, or pregnant, you get an additional cleaning at no cost, so 3 cleanings a year. And it is on the honor system, which means the dentist does not ask you for any medical information. Again, preventative care covered at 100%. Basic services, which are going to be your emergency services and cavities and simple extractions, is covered at 80%, and you're going to pick up 20% of the cost. That is when your individual deductible or family deductible on this plan comes into play. So it's once a year, so it's $50 for an individual or $150 as a family. Now, if you never need any of the basic services, you don't have any cavities, and all you go in is for your cleanings twice a year and your preventative exams, you'll never have to worry about that deductible. Now, major services such as a root canal, endodontics, periodontics, things of that nature, it's a 50-50 cost share between yourself and Delta Dental. And if you had not at that point paid that deductible, you will be subject to it at that time. So it's one time during the calendar year for basic services or major services. And then again, you have a $1,500 annual maximum, and then additionally $1,000 to use towards child orthodontia, and that's once in a lifetime. So if your child used that benefit in 2020, they don't get that same benefit in 2021. So it's a one-time benefit. The next plan we have to offer is a Delta DHMO plan. So this is a plan that has no deductible, no annual maximums. You can use the plan as much as you want and as needed. So your cleanings twice a year is covered at 100%. If you need additional cleanings, they're going to be $40 per cleaning. And then again, no annual maximums. There is no deductible. Everything is going to be on a set fee schedule. So this screen shows you actual pages from the fee schedule. So you'll see all the dental codes listed here with this D and then a number that follows it. So whatever is associated with that amount, whatever dollar amount, that's what you're going to pay for those services. Okay. You do have to elect a primary care dentist for yourself and each member of your family that is enrolled in this plan. You may each have your own primary care dentist, and you may change it at any time during the calendar year. You're not stuck with that dentist. Now, if you do not select a dentist, one will be appointed to you based on your home zip code. Again, at any time, you can pick up the phone and change it or go online and change the primary care dentist. Some examples here of what it costs for the services. Again, this first section here is going to be diagnostic, so no cost. And as you move down the screen, so on this side, orthodontia for adults is $2,100. Orthodontia for children is $1,900. And that is your out-of-pocket expense. That's how much you're going to spend for those services. It's not an allowance, it's a maximum. You can use your HSA dollars or your FSA dollars to pay for these services. Any questions? Okay. Delta Dental does have a website and a phone app that you may download. There's information on there how to find a dentist. Your ID card can be downloaded as well, so you don't have to carry that in your wallet. It'll be conveniently on your phone. So I invite everybody to go on the Delta Dental website and enroll or create a login so you can take advantage of all the free resources that are available. Vision plan, no changes to this plan. It is still with iMed using the Insight network. So the eye exam is every 12 months at a $10 copay. So this is our second year, 2021, offering this particular plan. So it's going to be a full rolling 12 months for that eye exam. For example, if you went in 2020 on July 1st, you will have to wait until July 1st of 2021 to go in and schedule that eye exam. And then your frames, again, every 12 months, you get a $120 allowance. And then anything in excess of 120, you get a 20% discount. Your glass, oops, sorry about that. Glass lenses, single vision, bifocal or trifocal is going to be a $10 copay. And the contact lens is available every 12 months in lieu of glasses for your frames, an $80 allowance, and then you get a little bit of a discount above the $80. And then medically necessary or prescribed contact lenses are going to be covered in full. Any questions? Okay. Next, we're going to go over the life insurance. As I stated earlier, there is a change in carrier. I do ask that you review your election form with MetLife. If you don't know how much you have today, you can reach out to your HR team, or you can, when you complete the enrollment form for MetLife, you can write across the top, leave as is or stay the same, things of that nature, or increase it by 10,000. So just something so we know if you're making any changes. Also, make sure you update your beneficiary form as needed. We do need to have the most current information on file. So if you're married today, legally married in the state of Arizona, it is a community property state, so your spouse should be your first beneficiary. After that, you may name whomever you want. Now, the event that you are not married and you have, a sister, a brother, a friend on there, at any time during the calendar year, you may contact your CBR team, and we will happily assist in sending you the form so you can update that beneficiary information. That's very important. Okay, going over the life insurance. So all employees working 20 plus hours are eligible for the benefit. It is a maximum of 5 times your annual earnings, up to $500,000. Your annual earnings under MetLife are going to be your base salary, commissions, and bonus. And guarantee issue, which means the maximum you can apply for is 5 times your annual earnings, up to $200,000. So again, this is guarantee issue, which means no questions asked, no exams, none of that. So if you're enrolled today under UNUM and you're just rolling over, you don't have to do anything. If you're newly eligible, a new hire, and this is the first time you're being offered this benefit, this applies to you. If you already have the benefit today, you can increase in increments of $10,000 up until you get to the maximum of $200,000 with no medical underwriting. So if you have $200,000 today under UNUM and you want to increase it, just know that anything above that, you will have to answer some medical questions. For your spouse, the guarantee issue is $25,000, and for children, $10,000. And then a big change in the benefit here is there is no benefit reduction. Under the current UNUM plan, the benefits reduce as we start to age. On this plan, there is no reduction. So whatever you enroll in, that is the amount that you have until the termination of the policy. Short-term and long-term disability is also going to be moving to MetLife. So if you're enrolled in that today, there is no premium adjustment unless you change age brackets. So that's if your age ends in a 0 or a 5, you're probably going to be changing age brackets. If you turn that in 2020 and 2021, you'll see some differences there. So the short-term disability covers, begins on the 14th day of accident, illness, or hospitalization. It covers 60% of your pre-disability earnings. And again, that's going to be your base salary, commissions, bonuses. And it pays up to $1,000 per week. This benefit duration is 11 weeks. There is a pre-existing limitation that I'll go over here at the end. And then the long-term disability begins after the 90th day or after the termination of the short-term disability. Again, it covers 60% of your pre-disability earnings, your base bonus and commissions, and pays up to $7,500 a month. And this plan terminates at age 65 or normal Social Security retirement age. Now, the pre-existing limitations applies to both plans. So what that is if 3 months prior to the effective date, you saw a provider or diagnosed or took medication for a condition in which you went out on leave in 2021, that would not be a compensable event until the following year. So, for example, if you were diagnosed today, if you're pregnant today and you bought the short-term disability and in 2020 you went out on leave, you would not be covered for that 2021 leave. So that's how the pre-X works. EAP, the Employee Assistance Program. So this is available to all employees, whether they are enrolled in the medical plan or any of the benefits. So the EAP is available to all employees, all staff, regardless of enrollment in anything. So Support Link is the provider, so you have access to that 24/7, 365. There is a flyer also that went out on how to go onto the website, enroll, and use the services. Again, at free, at no cost to you and your family members. You can use it 24/7. You do get 3 face-to-face or Skype visits per incident, per family member. And then also on the website, there are videos available on, different types of videos, exercise, wellness, yoga. There's also a discount program when, the theme parks start to open up, or restaurants or movie theaters. So there's a lot of good benefits on there for all the employees that they can take advantage of at no cost to them. So I highly recommend it. And one more thing, it is 100% confidential. So we will not get any reports in regards to who called or why. We do get an aggregate report saying how many individuals used it, but we never get names or reasons why the service was used. So if you need additional information on the EAP, again, there's a flyer included, but if you still need additional information, please reach out to me and I will be happy to assist. Okay, AFLAC. So AFLAC continues to be offered. So those of you that are enrolled in AFLAC today, you will be contacted by AFLAC. There was some change in premiums, and you will probably see a little bit of reduction in your premiums depending on the plan that you're enrolled in. So the accident policy, so that covers anything from a paper cut to broken limbs, broken bones, it pays you directly, does not pay the insurance company, does not pay the hospitals. It pays you, the owner of the policy, directly. Short-term disability is also available through AFLAC. So if you are family planning in 2021 or thereafter, I would recommend that you fill out your interest form and we can get it to an AFLAC representative so you know what all of your options are, what's going to offer you the most coverage, the most benefit back to you at that time when you are on leave. Hospital plan, when you're hospitalized for any services. So if you are family planning, you're going to go to the hospital to have that baby. So that's a good coverage there. Critical illness for anybody that has family history of heart disease, cancer, stroke, things of that nature. It's a good plan to have because they pay a lump sum upfront upon diagnoses. So it does help alleviate some of those medical bills. Do not have to use it for medical. You can use it for whatever you want. And again, these policies are owned by you. Should you ever leave the company, you can port these policies and just pay for it yourself. If you are interested in learning more about these policies, please complete your interest form and get it back to us so we may have Jose or one of his team members call you. Pet healthcare. So there's a little bit of a price increase for 2021. It's also included in your packet, your flyer. The pet healthcare or pet care covers all pets with the exception of fish. So anything under the sun with the exception of fish. Not sure why. Additionally, if your pet has a pre-existing condition or is sick today, you can cover the pet and they won't, there's no pre-existing limitations. So if the dog's already sick, they will still cover. And there's a lot of providers here in the Valley. So you can go onto the website and see if your provider, your veterinarian is already part of this discount program. Legal Shield and ID Shield. So Legal Shield are a group of attorneys that help navigate through any of the legal problems. They are available 24/7. They have a library of legal forms that you have access to when needed. And ID Shield protects you against identity theft. So if you are enrolled in any of these coverages today, that will continue forward. No changes in the coverages or the premiums. If you want to enroll, there's a flyer in your packet that shows you how to enroll. And it is a payroll deducted benefit along with the pet health care. So again, we're just going to go over next steps, very important here. But before I do that, I want to open it up for any questions. Does anybody have any questions on anything we've discussed today?
No questions so far.
Okay. So then just next steps here, if everyone can please complete the enrollment forms, the DW or medical enrollment form. Everybody must complete and turn one of those in, whether you're enrolling or waiving. We do have to account for all waivers as well. Your MetLife forms, if you're enrolling in the life insurance or disability products for the first time, please complete those to the best of your ability. And they need to come back. We'll reach out to you if you have any questions. If we have any questions. If you're going to be enrolling in the flexible spending account, you do need to enroll in that year over year. It does not automatically enroll. If you're enrolling in the high deductible health plan with an HSA, follow the instructions in your benefit guide, and it shows you how to open that account. We do recommend that you open it as soon as possible, even if there's no money in there. We just, the reason it's important to open it is, let's say you have a claim come through in January, but you have not yet opened your account. And any money going into the account after the claim hits, you cannot use to pay for that previous claim. But if you open it before any claims hit, even if with zero balance, that allows you to pre-tax that amount that you need to put away to pay for that claim. So very important there. Any questions on anything? So if you have an existing account with UMB Bank, it'll stay the same. You just need to indicate on your enrollment form how much pre-tax dollars you want to go into that account. You do need to enroll in a high deductible health plan again in order to qualify for that HSA. But if you have it open today, you do not need to open a new account. That does automatically stay open. Any other questions? All right. Thank you, everybody, for your time today. I will convert this to YouTube link and send it out.
All right. Thanks so much.
Thank you, everybody. Have a great day.